right. Well, welcome everyone. I'm Jake Grumbach. I'm a faculty affiliate with WISIR, the Washington Institute for the Study of Inequality and Race, as well as an assistant professor in the Department of Political Science at the University of Washington. And I'm lucky enough to be the moderator for today's event. It's the third of 4 webinars in WISIR's series on contemporary race and politics in the US. And the topic today is COVID-19 and racial inequities. So this should be a fantastic discussion. There's plenty to talk about here in this ongoing crisis. And first, I'd like to welcome our esteemed panelists and also all of our attendees, including UW alumni, students and faculty, community members from the Washington area and across the country, as well as colleagues across the country and world. Thanks everyone for being here today and for your support of WISIR. I also want to thank all the staff and our WISIR graduate assistant, Rutger Ceballos, and WISIR director, Sophia Wallace, for making today's event possible. So COVID and the response from US governments have led to over 400,000 deaths and really some economic devastation. But these consequences haven't been experienced equally. They interact with pre-existing inequities in areas like race. So to discuss this issue, we have an outstanding panel today featuring Professor Hedy Lee from Washington University in St. Louis, Jamila Michener from Cornell University, India Ornelas from UW, University of Washington, Gabe Sanchez from the University of New Mexico. All have published extensively on issues of race, inequality, attitudes, political behavior, public health, and so forth. And we're so lucky to have them all with us today. So today, the format of our panel will be about 40 minutes of discussion with myself moderating, followed by questions from the audience. So please submit your questions using the Q&A function at any time during this webinar. And you can upvote a question to express support for us addressing it on this panel. So first, to sort of set the stage, I see some attendees still trickling in, but first to set the stage, we're gonna turn to Gabe Sanchez, who has some data on trends related to COVID and race. So take it away, Professor Sanchez.
Thank you very much, Jacob. As I'm sharing my screen with folks, I'd just like to take a quick second to thank you, Jacob, for being a wonderful MC. Sophia, you and your whole team at WISIR for putting together a truly outstanding panel presentation. I'm honored to be part of this rockstar panel. I think I go back to maybe 2007, 2008 in terms of collaborating with WISIR. So big fan of y'all's work and I appreciate being included. So without further ado, I appreciate the opportunity to share a few slides to hopefully set the stage and provide some overarching trends. What you're looking at is outcome data from our American Election Eve poll. See, has a little over 15,000 respondents across racial groups. And what it allows us to do is take a quick snapshot of how some of these outcomes, none of them positive, right? We're talking about some very difficult data today in our conversation, how this compares across racial groups. And so you see when we ask folks directly, you know, have they themselves or a family member, a friend, somebody in their network fallen ill due to the coronavirus, you see we can point out that unfortunately, again, there's racial and ethnic inequalities across these outcomes. And one way that I've been talking about this is Rogelio Sainz, pretty famous demographer at UTSA, has been putting out data on Hispanic or Latino COVID-19 cases across states. And he has consistently pointed out that in every single state except my home state of New Mexico, Latinos are disproportionately impacted by those outcomes. And unfortunately, the only reason why we're not seeing that same trend in New Mexico is because our Native American brothers and sisters are being impacted to even a greater extent, only representing 10% of our population, but over 50% of all positive COVID-19 cases. And I think that speaks loudly, right, to what we'll be talking about today, the inequalities based on race and ethnicity and other underlying demographic categories in these outcomes. Although for good reason, we speak mostly about the direct consequences of COVID-19, I want to stress that potentially the economic impacts that we're seeing associated with COVID-19, not only, again, as you see, have huge disparities in terms of race and ethnicity, but are going to be long-term trends. Most of us are talking about this potentially in the context of 5 to 10 years out, that we'll still be seeing the effects of these outcomes. So you see whether we're talking about job loss, having your work hours cut back, or like many of us talking about the drop in small businesses, right? Particularly important for a lot of these communities that have really been the drivers of entrepreneurship and small businesses. All these outcomes point out that it's going to be a long road of recovery, and it's going to take years of economic support to help these communities rebound from this devastation. We also want to point out that we've been doing a lot of work in terms of education loss associated with the youngsters that are trying to continue their education at this difficult time. And obviously basic digital divide inequalities, particularly for the American Indian population across the country, are going to make that gap that already existed, right, in the context of educational outcomes, unfortunately only widen over time. And then finally, right, as a political scientist, I always want to talk a little bit about what all this might mean. And I know we'll get into this later in the panel for public policy preferences and political outcomes. And here you see when we asked everybody in this large sample, what were the most important issues they think the federal government should address at the time that they were voting, you see, not surprisingly, the coronavirus pandemic, right, is definitely the #1 issue across all racial and ethnic groups. And in fact, some of the work that I'm doing now points out that this has drowned out even immigration policy as a key issue for the Latino population. You see, it's not even here among the top list, which for most of us, right, is a huge surprise given how central that has been. So hopefully this gives you a little bit of some overall background and some broad landscape that hopefully will allow the rest of us to dig much deeper beyond these just basic numbers.
Outstandingly informative on sort of health outcomes by race, the intersection of economic outcomes by race, as well as sort of relationships with political attitudes by race. And with that jumping off point, I'll turn to our panelists and sort of go in alphabetical order to ask them sort of just first, what is the main thing when we think about the intersection of COVID-19, the crisis, and racial inequities in the US and beyond? What is one thing that our audience should know? Professor Lee.
Before I answer the question, I also just wanted to thank you for moderating this panel and for Sophia and her team for putting all of this together. So I was thinking a lot about this question because you sent it to us ahead of time to kind of think about. And for me, I think the main thing I think is important to think about when we're thinking about COVID-19 and racial disparities, intersections with race, ethnicity, is that this is not new. That while the COVID-19 infection is new, it's the novel coronavirus, racial disparities and health outcomes has been a consistent reality in the United States for a very long time. And if we were to experience another infectious disease in the future, if we don't change our social structures and policies, it will look exactly the same. And so I think that's really important because as much as I want us to think about COVID-19, it's really important to place this in context and think about other kinds of health outcomes like HIV/AIDS, for example, that we have seen similar patterns and stories about. So that's what I would say, and I'll let the other panelists chime in.
Thanks. Professor Michener, same question. First top line thing we should know about COVID-19 and race.
I think this really resonates with what Professor Lee just said, which is something that my mom used to say to me all the time and is sort of biblical in its orientation, which is you reap what you sow, right? And when I was a kid, I hated that because I'd do something ridiculous and then I experienced consequences shortly thereafter. And my mom would sort of shake her head and tick, tick, tick and say, well, you reap what you sow. And now I find myself saying it to my own children, but more than that, I find myself thinking about the implications of that core logic for our country, right? What we've sown over decades is underinvestment in public health and healthcare infrastructure more broadly, underinvestment in equality, weak to non-existent commitment to racial equality, to socioeconomic equality, to class equality, right? Underinvestment in the welfare state, right? In making sure that people in the United States have access to the material resources that they need to survive and thrive, and ensuring that their social rights are considered and are able to be, protected. And overinvestment in the carceral state, right? Overinvestment in punitive state institutions that in fact make people trust the government less, and disengage rather than engage. And we've seen more and deeper political divisions that make it harder for people, in particular, people who are racially marginalized, to trust, right? And all of those chickens are coming home to roost in the context of COVID-19. So what Professor Lee said is absolutely true. This is nothing new. It's exactly what you should expect if you underinvest in the ways we have and you overinvest in the ways we have, and you allow the various divisions and inequalities that are rife in American society to grow out of control. And then suddenly you're hit with a pandemic. This is exactly what one would expect, right? So there's no reason to be surprised. And I think the question we should ask going forward is, what is it that we want to sow in this next stage, right? So that the next time there's some sort of a crisis, whether it's a pandemic or some other kind of major crisis, we can reap something else other than what we've so painfully reaped these last 10 or more months.
Extremely well said. Professor Ornelas.
Yes, thank you. These are all great points, and I definitely agree. And thank you again for inviting me to be part of this panel. Really happy to be here. So I have spent a lot of time looking at the intersection of race and gender and Latinos in particular, and spent a lot of time looking at social inequities and how they show up differently in terms of health patterns for Latino men and women. And I think that, what Jamila and Hedy have said is that, yes, we're seeing the same exact thing that we've always seen. And so when we think about COVID in particular, what's happened for Latino men is that they are working in occupations where they have less workers' rights, less protections, more chance of exposure in that way. And then we see maybe a slightly different pattern for women where they're more, maybe not as increased risk for transmission, but the impact of COVID is hitting them harder because they are the people in the family that have more family obligations. They might be struggling with social isolation, more childcare burdens, more caregiving burdens. And so I do think it's really important to think about intersections of race and gender and how this might be playing out differently in terms of what we see in terms of both the health impact, but the other economic and education impacts as well that we're starting to talk about. And I would just say, I know we'll get to this at some point, but another really important layer and intersection for the Latino community in particular is that of legal status. And we've seen that undocumented immigrants have been particularly impacted by COVID because, again, of issues related to work, issues related to housing, and lack of access to healthcare.
Outstanding opening sort of salvos from our panelists here. So I'm wondering if we can get more in depth on specific ethno-racial groups in the US. So we heard some really great analysis of the intersection of race and gender there with respect to the Latinx community in the US. Similarly, how can we understand, so Professor Sanchez showed somewhat there are different trends that across racial groups, but ones that sort of map on to racial marginalization in the US. But how do we understand sort of racial inequities by group when we think about our Native American communities, the Latinx community, Black Americans, AAPI Americans, and white Americans, and so forth? Anyone feel free to jump in.
I'll start. I'll take a crack at that one and hopefully allow folks to dig a little deeper. I guess I'll give a couple of examples that I think stress some of the nuances that might be specific to one racial or ethnic group, but then also the overarching issues that I think are tackling all disadvantaged or underserved communities. And I think, as the panelists have already noted, it's critical that we always stress that the outcomes that we're talking about were not driven by COVID, but were a result of COVID, or basically COVID shedding an example on the existing structural inequality, structural racism that is in play. In fact, I'm hearing already a lot of folks essentially trying to essentially remove themselves from responsibility by saying COVID created this. And obviously we all know better than that. And we have to hold folks accountable, policymakers, private industry, et cetera, with that. So a couple of examples. One that I think is overarching is if we think about the foreign-born or immigrant population that Professor Ornelas alluded to across all these different racial and ethnic groups, Not only were they much less likely to have health insurance, in some of these communities, over half of the undocumented segments not having health insurance before the outbreak of COVID-19, but you've also had an extremely punitive immigration climate that has caused many members of these communities to avoid going to receive medical services, get tested for COVID-19. That puts all of us at risk. And I think the best example there is many of us know that the public charge rule went into effect just weeks before the outbreak of COVID, right? And as a result of that, a lot of folks, the last thing they want to do is interface with medical institutions right now, although it's not only in their best interest, but the wider interest of the population. With actually Laura Evans from y'all's institution and other colleagues, we've been modeling COVID-19 infection rates among tribal communities across the country. And not surprising to any of us, one of the strongest predictors of COVID-19 rates across tribes is access to basic plumbing and running water. The fact that we're even talking about Americans not having access to those basic resources, not only, right, that it's driving COVID-19 outcomes, I think speaks to this gaping issue of structural racism and basically many communities just completely being ignored by public policy over the past several decades, and in fact, across multiple generations that will lead to these outcomes.
Yeah, I mean, all of this is right. And one way that I think about the sort of different processes through which different racial and ethnic groups are sort of variably exposed to and affected by COVID-19 is to kind of think through specific mechanisms, right? And sort of understand, that helps us to understand why those different mechanisms would have different implications and outcomes across racial groups. And the reason why that's important is because, in exactly the way that Gabe just pointed out, it helps us to kind of emphasize or underscore the fact that it really isn't about COVID-19 itself, right? It is about these sort of pre-existing structures and realities. And really importantly, because I've also heard a lot of misunderstanding about this, it isn't anything inherently about these racial or ethnic groups, either like something biological or genetic, or something about their behaviors or their choices, right? And we only can really start to understand that when we think about what some of the mechanisms are. And there are more than we can talk about in this space, but just a couple examples, right? If you think about racial segregation and isolation as a mechanism, right? That's a mechanism that won't affect all racial and ethnic groups the same way, right? It's gonna have disproportionate effects, for example, for Black Americans, and also in different ways, but to a similar extent for American Indians, for Native Americans, right? And the isolation comes from, and the residential or the racial segregation comes from sort of different sources. The processes that led to those outcomes are different, but the implications in the context of COVID-19 mean that you're more likely to be cut off from crucial resources, right? And you're more likely to be surrounded by people who are also getting COVID-19, surrounded by people who are frontline workers, surrounded by people who are disproportionately vulnerable in a number of other ways, right? When COVID first broke out, and I was talking to my family and my brothers, my sisters, my parents, they're all in Queens in New York City, living in these hyper segregated neighborhoods. And it's just every week, it's like, oh, so-and-so got COVID, so-and-so up the street got COVID, so-and-so. I mean, so many people, right? And it's just countdown until they got it, because how can you avoid it? You know, my brother is driving Uber in neighborhoods where the COVID rates are off the charts, right? And so if you think about mechanisms like that, similarly, like, you know, who lives in intergenerational households? We know that that's been part of the locus of what has explained some of the spread of COVID-19, right? My mom, my dad, my brother, my sister-in-law, my nephew, my nephew's daughter, they all live in the same house, right? So when one person gets COVID-19, my nephew did get COVID-19, it's an entirely different ballgame because of that sort of intergenerational household kind of setup. That means, for example, that immigrant families, like my family is, and like many, for example, Latino families are going to be disproportionately exposed, right? And so those are just some examples. We could go on and on, but the idea is that yes, racial and ethnic groups are experiencing this differently because the processes that are racializing them and that are marginalizing them are different. And understanding those processes and thinking closely about them is what's going to help us to figure out what needs to be fixed. Although in many ways we know what needs to be fixed, and it's a matter of getting the will to do it.
Just to put a finer point on what Jamila has been saying, we also see this in terms of the different patterns of morbidity and mortality. And so in Latinos, we see that it's people are getting COVID that are much younger and dying much younger. And so really a lot of, years of life lost, whereas in African-American communities, it's been more in older populations. And I think that, again, reflects the mechanisms that maybe people that don't have access to adequate health care in their neighborhoods, or that when the elderly are getting sick, they're not getting the treatment they need, or they're, experiencing discrimination when they go into healthcare settings and try to access treatment. Whereas Latinos might be getting it younger because of this exposure due to multi-generational households being essential workers. And so I think that we're seeing that play out. I also do a lot of work on the Navajo Nation, and really the way that is getting spread onto the Navajo Nation is because of contact with off the reservation. People have to drive so far to get to resources because they are so isolated. And it's when they leave the reservation that they're getting COVID and bringing it back to other communities on the reservation. And, I think all of the issues around what has been said about infrastructure are also just so important when you think about the impact on these communities long-term. Remote schooling means a totally different thing when you're living on the Navajo Nation where you don't have access to internet, right? That can't be a given.
Yeah, I think I'll just to add to what India's point too is I think it's also helpful when we think about, because oftentimes when we talk about mechanisms, we get stuck on these proximate determinants, sort of the easy fixes, like, oh, well, maybe we can just bring supplies to, certain areas. But as India just noted, we have to change actual infrastructure. And so thinking more large scale so that, again, we can address what's happening with COVID-19, but be prepared the next time our nation, our world experiences a pandemic or some other kind of emergency, I think is important too, to just make sure we're focusing on these large scale distal mechanisms and not just the sort of easy low hanging fruit types of interventions that we often think about.
Great. So a lot of you touched on particular sort of pre-existing policy regimes in different areas and how they've led to an extreme sort of vulnerability to a pandemic like COVID, especially with respect to racially marginalized communities. So in our next sort of set of questions, I'd like you guys to delve a little deeper into these policy areas. So one that's been implicated is criminal justice policy in the US and mass incarceration. We've seen issues of sort of outbreaks within prisons and jails among wards of the state in sort of states and cities across the country. We've also seen issues that you've all mentioned in terms of health insurance policy and healthcare policy. You've mentioned housing policy, issues of segregation and sort of geospatial policies. And we've heard about education policies and remote schooling, and also immigration policy in the US. Take any of those sort of policy areas I just mentioned and sort of give us your sort of expertise on that subject with respect to COVID and race.
I'm happy to jump in here. It's really hard to choose just one, but I will, because otherwise I'll go on for too long. The policy area I've been thinking a lot more about lately and doing some research around is housing. And it's really quite staggering, the depth of the kind of problems that COVID-19 has brought into sharp relief. So we were already facing an eviction crisis even before COVID-19 and already had millions of people facing eviction every year in this country. But it certainly wasn't an issue that was as salient as it became in the wake of the pandemic. And one of the kind of primary policy interventions that we've seen since the pandemic started to spread is this intervention of an eviction moratoria, right? Okay, the problem is that people can't pay their rent because, you know, they've lost their jobs and largely through no fault of their own. And so of course they can't pay their rent. We're just gonna put a moratoria on evictions. We're gonna stop landlords from actually being able to make people leave their homes, even if they're unable to pay their rent. And I think that kind of policy, of course, eviction moratoria are really essential and, and we need to have them in this context. But it's a very superficial approach to solving what is a fundamental problem with our larger political economy, right? And what it does is it just stops the clock for people for a few minutes, or for a few months, or however long the period of time is. And once the clock restarts again, they're still responsible for paying all of that rent. They're still vulnerable to being evicted. And none of the core dynamics, for example, between tenants and landlords that disproportionately disadvantage tenants and make them, you know, sort of exposed to predatory landlords, none of those dynamics change. And similarly, the dynamics that account for the lack of affordability that so many renters were facing that made it such that they were teetering on the edge. And as soon as a pandemic hit, they were unable to keep up with their rent. Now, those affordability issues, those availability issues, and those issues of sort of power, none of those get addressed. Instead, we just say, hold the phone, we'll make it so that you can't get evicted for a few months. And I think that this is the kind of dynamic across policy arenas that we need to be cautious about and that we need to be looking out for, sort of papered over responses that stop blatantly terrible things from happening right now, but don't create any kind of transformation in the dynamics that made those policy arenas as they were insufficient for addressing people's needs going into this pandemic.
I'd like to turn to Professor Lee now.
Yeah, so I some of what you were talking about sort of connects to what I was thinking about. I think a lot of my work focuses on the criminal justice system, mass incarceration, implications for health, especially for family members who are connected to those who are incarcerated. And as was discussed, there's been a lot of discussion in the news about high rates of COVID-19 infection in prisons and jails. And this is sort of I don't want to use the word epicenter, but it's a place where we would expect to see high rates of infection. People are living in very close quarters. There's not a lot of access to sanitation in terms of being able to wash hands, and the other kinds of things we're able to do are a lot harder to do in the context of prisons or jails. Many prisons or jails are woefully underfunded. So these are also places and spaces where people are often not getting adequate nutrition, et cetera, making them even more vulnerable to infection, often not really great access to healthcare. And also, as was discussed earlier too, individuals who work in jails and prisons are also at higher rate of becoming infected, or higher risk of becoming infected and then infecting the communities they're connected to. And there have also been, as discussed with housing, some sort of short-term solutions that again don't necessarily address the experiment of mass incarceration, and needs to change more front-end policies to ensure that additional people aren't cycling through jails and prisons. But some have been pretty innovative, or maybe not innovative. Some of them seem, obvious, but would require some innovative policy work or mandates. And one has been decarceration. So can we use decarceration as a strategy to reduce COVID-19 infection? Work's been done by the National Academy of Sciences on this topic. And it makes a lot of sense if you think about it practically. There are individuals who don't necessarily need to be in jail or prison, and it would reduce the prison and jail populations dramatically, and also the staffing needed to support those who are in jail and prison. But then the question becomes, how do we then support individuals who have left jails or prisons? We have to then return to the housing question. Are there places for individuals to safely quarantine? Are we putting the onus of a person's return on families who are sometimes one flush away from eviction, right? So it's really interesting, like this discussion about thinking about how all of these are connected. So if we're thinking about policy solutions in the criminal justice arena, how is that going to then impact the policies we have in place or don't have in place for housing? Very practical ones, just like where are people going to even be able to quarantine, which a lot of places don't even have those kinds of protocols. But also, how do we support the families who, of course, care for their loved ones who are returning, but literally are a flush away from being evicted? And I don't say that to be alarmist. I'm saying it because it's a reality for lots of families. And so I think there's a really interesting connections that we have to think about when we talk about one arena, how it's going to impact another one, and all the people who are impacted. So those who are in prison and jail, but also their family members.
Do you want to go, Gabe, or? I'll just say that, yes, there's also a lot of parallels around immigration policy too, right? So detention centers are another place that we contain people, and the huge emphasis on immigration enforcement and detaining and deporting people, over the last 4 years, I think has also contributed to some of the COVID disparities. And so similar to prisons and jails, there's just not a lot of transparency around what's actually happening around COVID mitigation there. We don't have good data to understand, how many people are being impacted. Although I, have seen reports that there have been several outbreaks in detention centers, and that the cases increased steadily over last year. But I think that just in general, one of the ways that immigration policy has impacted again, especially undocumented immigrants and Latino communities, is just this fear of seeking health and social services because people have been so afraid of the government in general. And so this has impacted their hesitancy to get tested, their hesitancy to answer the phone calls of contact tracers, their hesitancy to seek services when they're sick, not having access to healthcare services because they don't have health insurance. And so all of that has contributed to, increased spread, increased transmission. And of course, now we're dealing with the issue of vaccines and whether or not these are actually going to be available to these communities. And even if they are available, if people are going to seek them out, because there have been so many ways that we have made people, afraid of the services that they actually have rights to and deserve and are eligible for because of our immigration policies.
Yeah, I'll follow up on that point briefly. I think everything that's been stated, I agree with 100%. And I think if we think about a health and all policies approach, which I think all of us as social determinants oriented scholars kind of think in that way, the data that we're seeing in terms of lack of desire to take the vaccine across these communities we're talking about, I think points to the obvious that across all these different public policy systems, there's good reason for our communities not to trust the federal government right now, whether we're talking about the immigration policy climate that we've touched on quite a bit already, or even a little bit more upstream, right? Just trust and information, period, because of all the misinformation that's directed towards our communities. There's good reason why we're seeing, for example, in our data among Latinos, 28% of national surveys of Latinos that we've done of the population say they're not going to take it or don't plan to take the vaccine, even higher among Latinas, right? And so you have to take a step back and say, well, we know from, for example, the huge outreach to the US Census, right? That a large segment of our populations didn't trust the federal government in just reporting their information to the census. Why are they going to put something into their body if they don't have an underlying sense of trust in the federal government? It's positive, right, that we're seeing a change in administration and a racial and ethnic equity task force behind this. These are all great things, right, that are going to help, but the clock is running, right? And so we're going to have to be very aggressive, use data, disaggregate that data to find out what the pockets are, who are the trusted messengers, et cetera, just like we would think of for the US Census outreach effort that took several months. Right now, we're talking about a more limited time frame. So I think that just points out that example of the vaccine, right? All the structural racism across all these systems, again, I think as has been noted, unfortunately have led to the outcomes that we're seeing.
So we've discussed a lot of that pre-existing policy regimes and how they've really impacted communities of color in the US with respect to COVID. With a few minutes before audience Q&A, I'd love to hear more about potential policy solutions. You guys have mentioned a number of them in some areas. For example, reducing incarceration, it's mostly a state and local policy area. We've seen some sort of modest movement, other things, state policies to be more inclusive to immigrant communities to attempt to build trust. We can think about media and information provision, health policy solutions, other solutions. Are there other things on your all's policy agendas moving forward?
So many things. And, you know, I think it's both a question of like the kind of long-term versus short-term versus medium-term, like what are the small-ish things we can do now that can get done quickly and easily that might that might allow for like immediate harm reduction, which is really important in a context where people are suffering, right? It's like, oh, I want everybody to have healthcare and I want everybody to have housing. I want those things to be a right that everyone has no matter who they are. And I think in the long term, those kinds of broad visions are important and they need to sort of animate both our conversations and the other policy interventions that we seek to see. But in the shorter and medium term, I think there are interventions that maybe are not so transformational or radical or grand, but are going to reduce harm and suffering. And so I guess my policy prescriptions tend to be a balance between those. When it comes to housing, I do think that there needs to be a significant move to, like many folks have asked for, cancel rent, right? So I think that when the eviction moratoria are lifted, and many of them have been lifted and continue to be lifted, people are just drowning in months and months of back rent. There's no way that they will be able to pay. And I think that we need some really direct resources channeled to address that. Otherwise, we won't see the eviction crisis stemming. The tide of evictions will not be stemmed. Instead, it'll just be elongated over time. And that's a real problem. I mean, all of these things are real problems, but that's just one that I would point to.
I mean, from the public health perspective, you know, we're thinking about how we, you know, can get out good messaging, you know, right away, specifically around COVID, around vaccines, around testing, around preventive behaviors. I mean, I think the good news is that a lot of communities of color really are doing the preventive behaviors, wearing masks, doing social distancing, have been all along. And so it's really important not to, again, do any kind of stigmatization of those populations or victim blaming, and understanding that, you know, their choices have been constrained, but even when their choices have been constrained, they are doing the right things. And then, you know, as Gabe was saying, now with vaccines, we just need very clear messaging around how people can safely access that, how it's available to them, that it's low cost, that their legal status won't be questioned, that they don't necessarily need health insurance. And I think there have been some great models in local and state public health here in Seattle and Washington about really putting equity first in terms of getting those kinds of messages out, using community-based organizations to get those messages out. And, you know, my hope is that we continue to use those strategies as we try to roll out more around vaccines.
I'll think briefly, a few that we haven't mentioned already, if we stick specifically to healthcare policy. Unfortunately, all the populations that we've talked about so far, less likely to have access to mental health care. And so we're seeing huge, especially among children, increases in significant mental health problems and challenges right now for obvious reasons, but lack of access, right? Another obvious one is sick leave policy. Again, all the populations that we're talking about, including my area of expertise, Latinos have the least access to sick leave of any population in the United States. And that's just so obvious in a time like this. Why can't we just address those not only for the short term, but the long term? And then thinking about economic policy, another one that is an unfortunate reality is because of the challenges we've all talked about, many folks are turning to payday loan centers. And a lot of states, right, these are not new issues. These have been problematic before, but now we're shedding a gaping light on the huge amount of increased revenues that these folks are generating, because as these folks turn to these, unfortunately, if they were already facing tough times after, in some cases, 500, 1,000% interest rates on these folks, they're going to be even worse off than they were before the pandemic hit.
I'll just quickly say, because I think everyone's covered all the policy bases. I keep thinking about your presentation, Gabe, at the beginning of the panel and the last slide where you showed that the priority is COVID-19 and how other sorts of policy areas have been overshadowed. And I wonder if it's because of what you've been saying over and over again, that COVID is all of these issues, that when people see COVID, they're seeing immigration policy, they're seeing housing policy, they're seeing education policy, paid leave, family leave, et cetera. It's because it is the embodiment of all our policy successes and failures in one category. Anyway, that's what I was thinking about when you were talking.
Agreed, and outstanding coverage of all these sort of ongoing. So what's amazing is so many of these policy areas and that you guys have mentioned are ongoing policy battles that were happening right before COVID. So paid sick leave mandates, for example, there's been state laws preempting localities from passing paid sick leave laws. Seems like not having paid sick leave is not the optimal thing to do in a pandemic, is to have people decide between going to work sick or essentially becoming destitute and losing their housing and so forth. Outstandingly important sort of ongoing battles in all these areas. And I hope the audience is interested in getting involved. We had an inauguration of a new presidential administration recently, new administration, new me, and I'm wondering if what you all see as the prospects for policy change in some of these areas going forward, how you feel about governance in general, 2021 in the coming years.
I think that to be totally frank, the bar was so low that it's easy to feel at least a little more optimistic looking forward. And I think even in the last few days, since Biden has taken over the presidency, we've seen a kind of quick inclination to take action with a slew of executive orders and using the kind of purview of the federal government, at least, to do things like implement mask mandates in the places, interstate travel, things like that. And the real emphasis, the real focus that we've heard again and again from the Biden administration and from public health officials like Fauci on sort of evidence-based decisions, right? We're going to do the things that the science tells us that we should do. So that piece with respect to public health is really heartening. And I think there will be a number of other arenas, even beyond health and public health, where we'll see similar moves to sort of quell some of the woes that have just proliferated over the last several years, honestly, even prior to COVID, and certainly the last several months. Having said that, any sort of bigger, grander expectations are always a little bit stemmed for me, because some of the core basic challenges that we face as a democratic polity haven't changed, right? We're still deeply divided as far as partisan polarization, as far as racism and white supremacy, as far as socioeconomic inequality and class. Like, those are arenas where the depth of our divisions are longstanding and have been exacerbated for years now, especially the last 4 years. And it's going to take a lot of work, and likely way more than the Biden administration alone will be able to accomplish, or will be willing to accomplish, for us to see like any grand, large scale change. But I think we'll see less harm, and that's a big deal.
Yeah, I'm really encouraged by, the task force, the leadership that we've seen, the representation of the leadership. It's really great to see people of color being chosen for high-level positions. It's just something we've never seen, that kind of representation in federal agencies before. And I think that will help ensure a really strong focus on equity as we move forward. I really have been worried over the last year about how gutted some of these federal agencies have become, in HHS and NIH and CDC in particular. And it's just really refreshing to see some new leadership there. And, hopefully again, I saw a meme of Dr. Fauci's face at the press conference, I think yesterday, versus the one that he was in with Trump. And if Fauci's face says it all, I think if, some of these federal agencies can actually do the work that they were hired to do, and use the science, that'll be a great thing.
Yeah, I'm an eternal optimist. So, especially given that a lot of what we've talked about isn't exactly the most positive on a Friday. I think, as noted, it feels like the cavalry is here. With the transition and the federal government. But the other side of me, right, digs into the data that we've been collecting over the pandemic. And unfortunately, right, we're in a federalist system where states have a lot of authority to adjudicate policy in their jurisdictions. And that worked a lot for a lot of our folks, to be honest, right, when they were combating what was going on at the federal government. But now as we switch gears, a couple of points to close with, at least from this perspective, right? When we look at mask wearing, for example, one of the strongest predictors in all the models we've been running is the partisanship of governor, right? With Republican governors, those populations being much less likely not only to wear masks, but do other behaviors that would reduce the spread of the virus. And if we look at COVID-19 outcome rates, I'll use Native Americans because I was looking at that data most recently. Again, one of the strongest predictors was partisanship of governor. So I think, a transition at the federal government levels, great. And I think all of us feel much better about where we are than we did several weeks ago. But that's obviously not going to solve everything.
Great. No, there's, a tremendous amount of quantitative evidence that, for example, the timing of lockdown orders, mask wearing, other sort of behaviors around social distancing and things are related really strongly to partisanship of governor, which is fascinating. And in this decentralized federal structure, that's extremely important, especially with health outcomes. So now I'll turn to some audience questions. We have some great ones. Sort of combining some from Eric and Neil here in the audience. They ask about differences by sort of industry and people's occupations and sort of other interactions with forms of marginalization. So we've heard already about some differences with essential workers and non-essential workers and publicly facing workers and so forth. Are there additional sort of nuances when we think about industry classifications and types of work that people do and exposure to COVID and potential policy solutions?
I mean, here in Washington, and I think other states as well, farm workers, were really impacted, didn't get the protections they needed early on, often living in crowded housing, were particularly vulnerable. And we saw rates, in some of our agricultural valleys really go up very quickly because they weren't getting the protections that they needed. I think we also know that people of color, women of color tend to work more in caregiving, nursing homes, health care, the janitorial staff of healthcare institutions. And so all of those places are places where there's more risk for exposure. I think hopefully in healthcare settings, they're also being better about protection, but that wasn't the case early on. And I think, just to touch back on something that Gabe was saying earlier, just the level of burnout that there must be in those occupations. I can't even imagine, how people are managing. And I think a lot of people are actually leaving, healthcare professions, which is very sad to see. And then obviously the service industry, people have been very impacted, and that tends to be, more populated by Blacks and Latinos. So the Uber drivers, as were mentioned, the people working in restaurants, grocery stores that are really getting, increased risk for exposure.
Yeah, I was going to just add on too. I was thinking of India, other groups, especially people who are coming into homes to clean and to perform childcare, can be particularly vulnerable. They don't often have the same kinds of job protections as discussed for some of the other occupations you talked about. And then I know I'm going to zoom to another group, but I do think we should be thinking about healthcare workers too. I think there hasn't been enough attention on the level of burnout they're experiencing and their own mental health. I mean, it's definitely impacted my family greatly, but there's, I think there are lots of policies in place that also often disincentivize healthcare workers to talk about their mental health or having any mental health issues, which was definitely amplified in times like this, when people are definitely, in general, everyone could have some therapy, in my opinion, but especially during these times, not having places and spaces and outlets for these individuals, and on top of being overworked, is really scary. And I think there's a mental health crisis that's impacting marginalized populations, but our population writ large. We've seen increased rates of suicide across the country as well.
I'll follow up Dr. Lee's point about childcare and early child care particularly, right? Overwhelmingly occupied by women of color across the country. And what a lot of folks don't realize is that industry, right, for professionals, most of which have advanced educations, tend to make less than fast food workers, right? And so as we're seeing this pandemic hit, it's critical that when we talk about economic recovery, all of our data suggests one of the biggest obstacles for folks being able to get retrained or get back to work is they don't have access to reliable and affordable early childhood care, right? And so as we're thinking about economic recovery, let's think about those folks, many of which have children themselves, right? And are trying to do Zoom-based education for their own kids while they're trying to support the rest of our children. And so I think that's a critical group that doesn't get enough attention, that we've seen is so vital to our overall economy, that we should spend much more time emphasizing in public policy discussions.
Great points, and reminds me about labor organizing too, where we think about these areas. So caring labor, typically unorganized, plus marginalized by gender and racial identity marginalization as well, immigration status. We think about the sort of the crises in outbreaks in meat processing and packing facilities, and the sort of mandate to return to meat processing early on in states that have really weak labor protections, which ended up having, again, sort of disastrous consequences for rates of infection in the pandemic. So these are issues where, protecting sort of the marginalized ends up having these sort of positive feedbacks for the rest of society as well. So a number of other questions sort of about the prospects going forward of COVID relief and the politics of that. So we've heard a ton about checks, debates over $600 checks, $2,000 checks. What do you guys see as the prospects there and the potential? We got a great question. I can't quite remember the name, but whoever put the question about the potential for sort of backlash to COVID relief that's equitable. We saw a sort of backlash to a move towards a modest move and switch of presidential administrations towards sort of an interracial democracy again. Could there be the potential for backlash to an equitable sort of COVID relief bill?
I mean, I think the answer is yes. And I really appreciate the question, because it points to a really important way of thinking about the processes, the political processes that are at play right now, which is we both have to think about what the sort of the policy aims are in the moment, and what kind of groundwork that lays for the future, and how it might undermine what kinds of policy options we have access to going forward, right? And so, I don't know what the COVID, relief package that's to come will look like. There are certainly broader possibilities now, given the composition of the Senate and given the outcomes of the election, right? And so it's possible that we could get, another relief package that's much more substantial than what we would have otherwise expected. And certainly that's more substantial than what has happened thus far. I think that there's a strong possibility there. The question is, what happens afterwards, right? And we've heard vanishingly little, I think, relative to what we heard during the Obama administration, but vanishingly little about the national debt, for example, during the Trump administration, even though it's been ticking up and up and up and up. it hasn't been the focal point for Republicans, of course, until we started to talk about COVID relief and to talk about getting actual aid to people in desperate need of it. Suddenly we were really worried about the price tag. And I think that kind of dynamic will continue. And it's going to require, in many ways, it's going to require people power, and it's going to require a movement to sort of push back against the scarcity mindset and to push back against the notion that if we do more in one arena, we need to pull back in another. To the extent that that's true, then there's still political contestation to be had over where the arenas are that we need to pull back, right? And is it that we need to decline or to decrease military spending? That we need to, stop giving so many tax cuts to wealthy people? There are places that we can shift resources, right? Decarceration is another mechanism for shifting resources, but that's not what the political conversation has looked like. So it's really going to require political organizing and power building to shift the conversation in directions that make these demands possible. Instead of saying, well, if we get a good COVID package, I guess we'll have to lose something else. We should be thinking, how can we build a politics that doesn't require that kind of sacrifice?
I just want to ask the rest of the panelists with our last couple of minutes to build off Professor Michener's comment there. How do ordinary folks get involved? This was an audience question as well. When we think about sort of movements for justice over 2020, for example, elections, other forms of political activism and participation, community involvement, what do you all think?
I'll jump in briefly, and I think, that was so well stated that I think the rest of us don't have much else to add, but I'll give it a shot. I think a couple things are, we've got to think about this, number one, as more of a long-term process, right? I mean, obviously, we've got to thank our brothers and sisters in Georgia for turning out to vote in the numbers that they did to give us the Senate numbers to allow the COVID package for the short term to be where it's going to be, which is amazing. But I'll leave you with this, right? The Latino population, for example, was barely recovering from the Great Recession right before the pandemic hit. I'll say that again for emphasis, barely recovering from the last recession before the pandemic hit. So this is going to take years of relief and much more aggressive economic development policies, right, to have the country as a whole recover from where we're at. And so that's going to take long-term, right, and aggressive political engagement. I think it was incredible that we saw the turnout rates that we did in this past election, but let's keep in mind, states across the country laxed a lot of their internal policies to make voting more accessible, including an increased use of mail ballots. Why don't we push to have those things put in place, period? Not just during the times of the pandemic, to allow the population to exert, right, an aggressive voice on policymakers to continue these efforts well beyond we start to see the news headings move in a different direction.
Yeah, I would just add too, in addition to voting, is write your state and local leaders. Writing letters absolutely matters. I am not a political scientist, but I know this to be the case, and it's an underutilized tool. Or you send an email if you don't write letters anymore and don't use stamps. I think those kinds of things are really important, and get a better understanding of the landscape of organizations that are where you live. I think a lot of us do not have a full understanding of the scope of the kinds of movement work that's already happening where you live. I live in St. Louis. There's so many great examples of movement work that's happening, places and spaces and people who've been thinking about issues for a long time. So just do your due diligence. Use Google and kind of see what's happening. I think these are small things, but these are the kinds of things that help to strengthen movements and ensure the kinds of things that Jamila is talking about actually happen.
Yes to more civic engagement. Yes to more community organizing and mobilizing. And while you're doing all of that, wear your mask and be socially distant and get your vaccine when you can and get tested if you had symptoms. So that's my parting public health message for you all.
And then just one last point, because my brain finally fires. Let's not leave private industry out of the equation, right? Use our power as consumers to put pressure on these billionaires, right, that in my opinion aren't holding up their end of the bargain in terms of relief. I look back in history, right, and other very difficult times in the United States, the pillars of industry, sometimes behind the scenes, work together, right? And try to improve outcomes for everybody else. Why aren't we seeing that from the pillars of industry? You folks are fortunate in the Seattle area to actually have a lot of pillars of industry at your disposal. As our power as consumers, let's put pressure on them and not let them off the hook, and only expect the federal government and state governments to respond in this difficult time.
Absolutely. All right, on that note, I'd like to close out our panel. Thanks again to our outstanding panelists here, and thanks to everyone who attended online across the world. This is the third of 4 WISIR talks this academic year on issues of race and contemporary American society. So look out for the next one. And thanks again to our panelists. Thanks again to Rutgers Ceballos and Sophia Wallace for organizing this event. Thanks again, everybody, be safe.